Hello, my name is Sujan and I'll be your nurse practitioner today, okay?
Okay.
Alright. By the way, I am recording this video and will be uploading in the YouTube and also submitting it to my university professors to look at it for educational purposes. Is that okay with you?
Oh.
I'm also asking the same consent with legal guardian. Um, um, Patient's mother is present here. Is that okay to upload this video on YouTube and use it for educational purposes?
Yeah. Okay.
Thank you. Alright. So, can you tell me your name?
Kushan.
When is your birthday?
June 29, 2012.
Okay. Alright. You might have to speak a little bit louder so that the video can capture your voice, okay? Alright. So as we can see, my patient is conscious, sitting upright and having conversation with me. So the level of consciousness is appropriate. Also, can you tell me what day is today?
2/10/2022.
Awesome. Good. All right. And can you tell me like one event that you did today?
We played soccer.
You played soccer. All right. Also, I can see patient's speech is clear and coherent, and can do a conversation with the provider coherently. Also, we can check your memory. So, also, I want to. Can you tell me what did you do today at your school?
I played soccer and basketball.
Soccer and basketball. Okay. Can you speak a little louder so the camera can capture you? Okay. Okay. Tell me about an event in the past. Say last birthday. What did you do last birthday?
I ate cupcakes and I got new shoes. Then we going to go do a pinata.
Okay. Speak a little louder and clear. Okay. All right. Tell me something. Say you're coming out of the school and you see your friend just fall down in front of you. What would you do?
I would pick him up.
Can you speak louder?
I would help him up.
Uh-huh.
Then take him to a teacher or something.
Okay. Good. As we can see, my patient also demonstrates appropriate judgment skills, and also demonstrate having short-term and long-term memory. Now what we're gonna do is we're gonna check for cranial nerves 1 through 12, and do cranial nerve test. First, what I would like to do is check for your olfactory nerve, which is our smell. So what I would like you to do is close your eyes and cover one of your nostrils, and then I'm gonna let you smell something, and then you tell me what you smell. Okay? All right. So can you close your eyes? Cover your nostril. Tell me what you smell.
Orange.
All right. Can you cover other nostril and tell me what you smell?
Orange.
Orange. All right. Perfect. Now we're gonna check for the second cranial nerve. That's optic nerve. And what we're gonna do is we're gonna do a phonoscopic exam and look at the patient's optic disc and eyes. So So I'm going to use my right eye to patient's right eye to view, do the fundoscopy exam. Okay, what's that? I would like for you to look at me. So going in at 15 degrees, I am looking for red reflex. Look straight in front of me. Do not look in the camera. Look towards me. All right. And I'm looking for red reflex, which I can see. I can also see pupillary constriction with light shining on the eyes, and look straight forward towards me. And I'm going to use my safety, use 3 fingers to safely guide as I'm closing in. And I'm waiting for the retina, the optic disc, which is sharp, without floaters or cotton or wool appearances. And I can see the vessels are intact without any signs of deformities. I would do the same thing on the other eye, going in at 15 degrees, seeing the pupillary reaction, and I'm doing the fundoscopy exam, looking at the optic disc and any obvious changes. That test for cranial nerve number 2. We can also do the Snell's chart for optic nerve number 2, where I would be at 6 feet distance, and I asked my patient to read the smallest line the patient can read, covering one eye at a time. So can you cover one eye? Alright. And read the smallest line that you can read.
LTFPH.
Alright, now let's cover your other eye and read it.
LTFPH.
Good. Now let's open both eyes and then read it. Good job. So, patient demonstrates 20/20 vision, which means a normal person would see, Usan sees at what normal person sees at 20 feet. Alright, so now we're gonna do the oculomotor number 3 nerve test. In this test, what we're gonna do is we're gonna shine a light in your eyes and see your pupil constrict. Okay? I don't know if the camera can see me. Alright. Look at me. Alright. Look at me. Alright, as I shine the light, pupils constrict. Now, this is the direct test, and as I shine light, I also look for pupillary constriction in another eye, which is a consensual test. And as I shine this light, I see pupillary constriction in the other eye, confirming of consensual pupillary constriction. Alright, now we're gonna check for your cranial nerve number 4, which is trigeminal nerve. In this test, what I am going to do is I am going to ask you to clench your jaw. Alright? Like biting down on something, where I can feel the muscles here Don't chew, just bite down. One time. There you go. Where I can feel the muscles clenching right here. Can you move your jaw left, right? There you go. All right, perfect. I'm also going to check for. I'm also going to check. If you close your eyes, I'm also going to check for your sensation in your face. Okay. So if you close your eyes, you tell me if it's sharp or dull. Okay.
Soft. 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 Sharp. Soft. Soft. Sharp. Sharp. Sharp.
All right. Good job. All right. So after our trigeminal nerve, we're gonna do. We're gonna check for your abducens nerve, which is cranial nerve number 6. So cranial nerve number 3, number 4, and number 6 plays part in extraocular eye movement, which we're going to perform now. So Ushan, don't move your head, just look at my finger and follow my finger, okay? Alright. Checking for cranial nerve number 3, number 6, number 3, number 6, number 3, number 3, come back in middle, number 3, number 4. Alright, and then also we'll be testing at accommodation. Alright, so that's extraocular movement, which is intact. Cranial nerve number 3, 4, and 6 is intact. Now moving on to cranial nerve number 7, which is facial nerve, which controls facial movements like smiling. Can you smile for me? Alright, can you frown? Alright. Close your eyes for me. Don't let me open it. Alright, perfect. Can you wrinkle your forehead? There you go. Good job. Cranial nerve number 7 intact. For cranial nerve number 8, which is vestibulo cochlear cranial nerve, we are going to do a whisper test, and we'll do Weber and Rene test. So for whisper test, I am going to cover one of the ears of the patient and whisper 2-syllable word or a word, and ask patient to tell me the word.
Baseball.
All right. So patient can detect the whisper and tell me the word. Now for Weber test, we're gonna which is used for identifying conductive hearing loss. What we'll do is we'll tap the tuning fork in my palm, and then ask patient if it's heard in either one side or both sides. Can you hear it on one side or both sides?
No.
Alright. Perfect. Now, for Rena test, we're gonna I'm gonna tap the tuning fork and put it in the mastered process, and ask patient to tell me when he no longer hears it, and then bring it back in front of the ear. Tell me when you stop. stop hearing this?
No.
All right, we'll do the same thing on this side of the ear. Tell me when you stop hearing it.
No. No.
All right, so as we can see, air conduction is longer than bone conduction. That tells the sensorineural hearing is intact. After our cranial nerve number 8, we're going to cranial nerve number 9, where I'm going to ask Usan to open up your mouth and do a big ah for me. Pull your tongue out, big ah for me. There you go. I'm looking at this soft palate, looking at the uvula, which is midline, and a rise of soft palate. Okay, that's cranial nerve number 9. Cranial nerve number 10. Can you swallow for me? There you go. That tells me patient's number 10 vagus nerve is intact. Can you open your mouth? Also, I could elicit a gag reflex to check on that. Cranial nerve number 10. Cranial nerve number 11, accessory nerve, spinal accessory nerve, basically checks the strength of the trapezius muscles. So I'm going to ask Usan to shrug your shoulders against my hands. There you go. I feel good strength bilaterally. For cranial nerve number 12, I am going to ask you to pull your tongue out for me. All right. And I'm looking to see if it's midline. Also, can you push your cheeks with your tongue? Push your cheeks with your tongue. There you go. Both sides. There you go. So, cranial nerve number 12, looking at the strength of the tongue and the direction of the tongue. If it's deviated to either one of the sides, that could mean whichever side the tongue is deviated, there is an injury on that side of the brain. All right. So once we did our cranial nerves, now what we're going to do is we're going to check your balance and your gait. So what I'm going to have you do is I'm going to have you stand up. All right, and come closer to the camera right here. All right, and then just turn around and walk for me all the way up to the wall and come back around. All right, okay, and have a seat. So I am looking for patient's gait. I'm looking for posture, which is upright, looking for balance, the swinging of arms, which is normal and equally on both sides. Now, I'm going to have you stand up again, and I will actually move this chair over here for a moment. It's probably going to block it. All right. So what I'm going to have you do is do a tandem walk, where you're going to walk in a straight line with your heel to toe. And if you can start from right over here where the camera can see you. All right, so that is a tandem walk tilt your toe in a straight line. If the patient had any cerebellar injury, patient would not be able to do that. Now I'm going to have you walk on your heels. Perfect. So this is basically checking dorsiflexion of heel. Now I'm going to have you walk on your toes. Perfect. So walking on toes basically checks for plantar flexion, muscle movement, and neurological condition. If there was any issues, patient would not have been able to do that. Can you come here? Now I'm gonna can't really see. Okay, there you go. Now I'm gonna have you. We're gonna do the Romberg test. Now I'm gonna have you put your feet together. All right. Put your arms out. Palms facing up. There you go. And close your eyes for me. And if you lose your balance, I am here. I'm not gonna let you fall. All right. Just close your eyes for about 30 seconds. A little bit of sway is normal. But patient with cerebellar lesion or neurological conditions would be way off. Now, we're also going to do pronator drop test where I am going to try to push patient's arms down, and if the patient had, that's fine. Now you can sit down. If the patient had any neurological problems, patient would have trouble coming back to the balance with pronator drop test. All right, now I'm gonna have you sit with your legs down like this, and we're gonna do rapid arm movements. So basically, what I want you to do is slap your knees, and then bring your hands up, turn your palms, and then slap again. Alright, and then do it as fast as you can. So I'm looking for the smoothness, if the patient can do it, the frequency, how fast the patient can do it, that's good enough. Thank you. Alright. Now what we're going to check is we're going to do the joint position test. In this test, what we're going to do, this is basically checking for your sensation. I'm going to have you close every sensation test pretty much needs patient to close their eyes. So if you can close your eyes, I'm going to take your foot and you tell me, I'm going to grab the big toe, pull it aside, and I'm going to either move it up or down, and then you tell me if I move it up or down. Okay, close your eyes.
Up.
Okay.
Down.
Perfect. Let's do this on the other leg.
Down. Up.
Perfect. Thank you. All right. Now, what we're gonna do is we're gonna do a sensory check again. This time, I'm gonna have you close your eyes, and I am going to draw something on your palm, and you tell me what I drew. Okay? All right.
Three.
Perfect. We'll do the same thing on the other hand.
Just a line.
Just a line. All right. Perfect. After our graphesthesia test, we're going to do 2-point discrimination test. So in this test, what we're going to do, I have a paper clip. It has sharp edges. So what I'm going to do is I'm going to put pressure on on a finger or on your skin, and you tell me if it's 2 point or 1 point, okay? Close your eyes for me.
2, 2, 1, 2, 2, 1, 2.
Alright, so that's 2 point discrimination and patient sensory is intact. Getting everything correct. Also, we're using tuning fork. We can do a vibration test. Usually, patient with peripheral neuropathy, usually caused by diabetes, lose their sensations in the periphery. So vibration would be most likely be the first thing they would lose. So what we can do is we can use the tuning fork and put it in one of the bony prominences and ask patient if they can feel it. Can you feel this?
Yeah.
So we can also do this in different body parts, but this test for peripheral sensation. Now we can also check for sensation of like tactile sensation. So I'm gonna have you close your eyes. All right, and then tell me if you feel soft or sharp. Okay.
Soft, 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 sharp, 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 soft, sharp, 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 soft, sharp, 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 soft.
Good job. All right. Now we're gonna after we're done with your sensory test, we're gonna do your motor test. In this test, we're gonna use your elbows, we're gonna use your hips, and your knees to check your strengths. First, I want you to extend your arms for me. All right, and don't try to go up against my resistance. Okay, try to push down. There you go. All right, good job, good job. All right, and try to grab my fingers as hard as you can. Don't let me pull out of it. Good. I see good strength. Bilateral equal strength. Equal grip in both hands. Also, let's use your elbow, and then let's flex it. Okay. You don't have to flex it out halfway. Not that way. Okay. And then I'm gonna try to pull down on it, and then you try to resist me. Okay. All right. So that's good strength he's got there, which is basically checking for biceps. Now I'm gonna extend this elbow, and then I'm gonna try to push it up, and you try to resist me. Okay. This is actually just flex it halfway. Flex it. There you go. Now I'm gonna try to push it, and then you try to resist me. Okay. This test for the triceps back here. All right, and we'll do the same thing on the other side, and compare with one another to see if the strength is equal on both sides. I'm gonna try to pull, resist me. Perfect. And I'm gonna try to push, resist me. I'm gonna try to push, resist me. There you go. Perfect. So that's checking biceps and triceps. Bilaterally, strength is equal. All right. Now we can also do that test in your fingers. So can you put your fingers, fan your fingers out, which is basically abduction of the fingers. And what I'm gonna try to do is I'm gonna try to put force and try to close them together, and you try to resist me, okay? Which patient has good strength. Okay, so that's our motor check. Also, we're gonna do the lower extremity checks. What I would like for you to do is I would like for you to lie back down gently. There you go. Relax. Okay. And let's flex your knee. Let's flex your knee. Both knees. All right. So we're flexing at the hip. I don't know if that's, you can see that. Yeah, I think a little bit is visible. So what I'm going to do is I'm going to put resistance in your knee, and you try to bring your knee together. Okay, let's do that. This is called adduction of the knees, adduction of the hips, and it's checking for adductor muscles. All right, and try to push my hands out. Try to I'm gonna put resistance in your outside of your knees, and we're gonna do abduction of knees. Push out. There you go. And good strength. These are adductor muscles. Now we're gonna check for quads and quads and hamstrings. So what we'll do is we'll take the knee and extend the knee. So I'm gonna support the knee right here with my hand, and ask patient to push down on my hands, and straighten out the leg. You straighten out your knee. There you go. So that's checking for quad muscles, quadriceps. Now I'm gonna ask you to I'm gonna try to pull, and you try to resist me. Okay. There you go. So trying to flex, and patient is resisting. So that test is for hamstring test. Now after this test, can you sit back up and come over here? Have your legs hanging. What we're gonna do is we're gonna test for the deep reflexes. So we're gonna use the reflex hammer. We'll start with brachioradialis, where we can use this to see the muscles twitching and the thumb going up. Same way we can do at the brachial. And we will do that on both sides. Now I'm going to do the triceps. I'm going to have you relax completely and let your arm against my hand. And I see that movement of the arm. Same thing we'll do on this hand. Brachioradialis, brachial. Relax, and then triceps. Relax against my hands. Relax. And we're looking for that tendon reflex. Now our deep reflex would be at the patellar reflex. So we're gonna tap here and look for that reflex on both sides, which I see is intact. And then we have our Achilles reflex, which we can tap at the Achilles tendon back here and look for that ankle reflex. Alright, now our final superficial test would be Babinski test. Can you put your finger, leg up here? So in this test, basically, what I'm looking for is the plantar flexion or dorsiflexion of the toes. What we're going to do is we're going to draw a line from the ball, from the heel to the top of the finger, so to top of the toe. And I can see plantar flexion. If there was a dorsiflexion, this would have been an abnormal finding, suggestive of neurological condition. So this basically concludes our test, neurological test. I want to thank you for being in the video, and we'll see you in the next video. All right, thank you.